The 2 billion plus population of the WHO Southeast Asia region is increasingly vulnerable to a range of emergencies from floods, cyclones, earthquakes, tsunamis, landslides, volcanic eruptions, heat waves and droughts to outbreaks, epidemics and pandemics of infectious diseases and emerging and re-emerging diseases. The 2004 Indian Ocean tsunami, a mega disaster that impacted multiple countries, killing over 200,000 people, was the turning point, with the region since then meticulously investing in strengthening emergency preparedness and response capacities. Benchmarks were set and a novel Southeast Asia Regional Health Emergency Fund, CRHEF, constituted to facilitate life-saving interventions in the immediate aftermath of a public health emergency. In 2014, Regional Director Dr. Poonam Khetrapal Singh prioritized building resilience and health emergencies capacity as a flagship program. WHO worked with countries to strengthen International Health Regulations 2005 core capacities to detect, assess, notify and report events and respond to public health risks and emergencies of national and international concern. There was greater focus on improving management of emergencies through advocacy, preparedness and response, information management, technical and operational support, and partnership. A series of resolutions, one every year, were endorsed at the regional governing body meetings for strengthening different aspects of country preparedness, readiness, and response. In 2014, the region resolved to strengthen health workforce education and training. In 2015, WHO and countries endorsed a resolution to scale up emergency risk management capacities, expedite efforts to prepare for epidemics and pandemics, and make health facilities safe and functional during disasters. In 2016, the region agreed to expand the scope of CRHEF to also fund emergency preparedness in addition to response. In 2017, WHO and countries agreed on the Malé Declaration for building health systems resilience to climate change. In 2018, the region resolved to strengthen emergency medical teams for them to be more effective during an emergency response. EMTs, as they are called, are an important part of the global health workforce. Thailand became the first in the region with WHO classified EMT. Bhutan, Indonesia and Sri Lanka EMTs are in the pipeline for verification. Just months before the COVID-19 pandemic, WHO and countries signed on the Delhi Declaration in September 2019 to strengthen emergency preparedness by scaling up risk assessment, increasing investments and enhancing implementation of multi-sectoral plans critical for COVID-19 response. In 2020, WHO Southeast Asia region resolved to a collective response to COVID-19 and strengthen the region's response with better equipped health systems to deliver essential health services during the pandemic. In 2021, a ministerial declaration was adopted to build back better with lessons from COVID-19 to strengthen health system resilience to ensure health security and achieve universal health coverage and sustainable development goals for health. These concerted efforts were evident in responses to public health emergencies in the last decade. When a devastating earthquake hit Nepal in 2015, the Health Ministry and partners were prepared and rolled out an almost spontaneous response. Within minutes, an emergency room was operational at the Health Ministry. Pre-positioned supplies were rushed to affected areas. CRHEF was disbursed to fill gaps in emergency response, early warning alerts set up, and coordination of medical teams initiated. Most importantly, health facilities, including major hospitals in Kathmandu, remained functional, attending to the injured, which helped reduce casualties substantially. As part of preparedness, the health staff were trained in mass casualty management and triage, and the facilities assessed for safety and retrofitted to remain functional. In July-August 2017, nearly 700,000 Rohingyas moved into Cox's Bazar, Bangladesh from Myanmar, and settled into one of the largest and what continues to be even today the most densely populated refugee camps. Timely and concerted efforts led by the Health Ministry with support of WHO and partners to meet health needs of the vulnerable population, to quickly immunize them against vaccine-preventable diseases, set up and expand quality health services, have all helped in preventing and quickly curtailing spread of diseases that afflict people living in these conditions. Preparedness and continued efforts have ensured minimize impact of even natural calamities and have kept overall number of disease and death numbers minimal. Indonesia government systematically scaled up preparedness over the years that helped reduce health impact of the frequent natural disasters. India rolled out impressive response to cyclones in Odisha and Nipah virus outbreaks in Kerala. Thailand was quick to identify importations of the highly infectious MERS coronavirus and prevented its spread. It was also the first country outside China to pick up COVID-19 case with an alert surveillance. During the COVID-19 pandemic, WHO and countries worked together enhancing awareness about timely and appropriate measures, setting up multi-sectoral coordination, increasing capacities of health sector by preparing health facilities, training health workforce, building and strengthening laboratory capacities, sharing information of circulating viruses, and contributing to research and vaccine development, production and supplies to countries beyond WHO Southeast Asia. The most challenging phase in the history of public health in the region was also marked with unprecedented measures. During the COVID-19 pandemic, the number of laboratories testing for SARS coronavirus grew from 5 to over 5,000, with laboratories with 10 countries now having genome sequencing capacities. Beginning January 2021, countries in the region have administered 3.35 billion doses of COVID-19 vaccine, with 74.1% of the population receiving their initial dose and 67.8% completing two-dose regimen. All along, the region has picked up lessons from all public health emergencies, big and small, to further strengthen emergency response capacities. SIA have funded 43 health emergencies in 10 countries since 2008. A regional roadmap built on the lessons learned from the ongoing COVID-19 pandemic is now being rolled out across the WHO Southeast Asia region to enhance preparedness and response capacities for public health emergencies with multidimensional impact.
Globally, risks from natural and man-made hazards are likely to result in major and frequent health emergencies in view of health systems weakened by the pandemics and the looming threats from climate change. The regional roadmap aims to protect the vulnerable and economies from the impact of public health emergencies by strengthening national and regional health security and health system resilience. The focus is rightly on building and investing in PHC-oriented health systems that leave no one behind and which are adequately equipped to prevent, prepare for, respond to, and recover from acute events while maintaining essential health services.